Welcome to Comments on LinkedIn. Today we are going to look at an article highlighted in a recent post by Dr. David Keaton. The article, written by Sophie Berdugo and hosted on LiveScience.com, discusses the newly proven link between treating gum disease and, believe it or not, your artery health. So, there's long been this suspicion about oral health and heart risk, right? Well, a brand new top-tier clinical trial gives us some solid proof. It shows that really getting after severe gum disease, that's periodontitis, might be this kind of unsung way to help keep our blood vessels working well as we age. Okay, let's break down the key takeaways. First, this 2-year study found that intensive gum treatment, we're talking a really thorough, deep clean below the gum line, actually slows down the thickening of those major arteries in your neck, the carotids. And less thickening, that's a great sign for lowering cardiovascular risk. Second, how does this work? Well, researchers think it's because the treatment reduces nasty stuff in the blood, like markers for inflammation and oxidative stress. What's really interesting is that this happens without even needing to tackle the usual suspects like high cholesterol. Pretty neat, huh? Now, I should note that while this really backs up the idea that untreated gum disease is something we can change to help our vascular health, there's a small catch. The study only looked at 135 folks who were otherwise healthy. So these results are more about preventing decline, not necessarily reversing artery hardening, atherosclerosis, if it's already set in. Bottom line, taking care of your gums looks like a really smart, proactive step for keeping your blood vessels happy. So, as we wrap up this episode of Comments on LinkedIn, I would like to extend a thank you again to Dr. Keaton. And of course, thank you, our listeners, for tuning in.